My name is Ike Ahmed. I'm at University of Toronto, and this was my first day using the TrueVision 3D system. To be honest, I didn't think it would be this easy. I was, Mark basically threw me in the first case of, Ike, we're going to take the scope off and put the 3D camera on. And I didn't protest it, but in my mind I thought, okay, I'm not sure if that's a good idea. It's a little crazy, but in fact, actually everything went very well. We continued that for the rest of the day. So certainly today showed that whether it's a dense lens, complex lens, or we had a few routine cases, it's quite manageable. I think the ergonomics will continue to be worked out. I was toward the end of the day, I was quite relaxed sitting back in my chair and operating rather than the typical, sitting forward and muscles tight and neck cranked around on the scope. So from that perspective, I think it certainly went very well. So we're pretty excited about where we've been able to take this, and both in terms of our routine cases as well as using guidance, application, overlays as really a surgical assist tool, not just something that's going to improve ergonomics and enhance the ability for others in the room to enjoy the surgery and participate in the surgery, but also in terms of acting as that third hand or that extra assistant in doing particularly complex surgeries or surgeries where visualization is a challenge, for example, in gonioscopic approaches. I think for most of us, we realize the emergence of MIGS, or microinvasive glaucoma surgery, which are ab interno gonioscopic procedures. Critical to this procedure is the ability to visualize the angle, number one, in a comfortable ergonomic way. Number two, to be able to place devices appropriately in those small spaces. We typically need to tilt the head of the patient, tilt the microscope. It creates certainly some issues ergonomically. We did some procedures today where we basically used the system in gonioscopic approaches, and I think already we're seeing we're able to get a larger viewing area in terms of access to the canal or the angle. I think the ability to add guidance, in other words, to add trajectories or to add assist in terms of where we need to be placing devices and in what motion, which is often it's just a 20-30 degree rotation of the hand or up and down movement of the hand that needs to be done to get the implants, for example, in the right spaces, whether it's in the canal or whether it's in the supracortical space or other areas in the angle. And so I think the ability to, number one, improve visualization, number two, improve the ergonomics around that, number three, to enhance the three-dimensionality of the angle. The technology does tend to emphasize the 3D aspect of the view, and for those of you that haven't used it, it's hard to explain, but essentially this gives you sort of a, I don't want to use exaggerated, but almost an emphasis on 3D, let's say. And I think in the angle that can be particularly useful where the spaces are small and the heads turn, the microscopes turn, so I think in those aspects I think it can really act as an additional assistant, and particularly as we move forward with perhaps using overlays and trajectory guidance systems to help place devices in there. So we're very proud to be the first center and the first hospital in Canada to use the TrueVision 3D system. We were lucky enough to have acquired the system. And so we're very proud in doing that. We really appreciate the tremendous support that we've got from TrueVision. Here with us we have Mark and David, and we have Mark from Canada here as well, who have really been instrumental in getting the device here, and been unbelievably flexible with my extreme, I would say, demands and expectations of the system. I think I really expected a lot, and they were really there for it. So that's an unsolicited comment from them, and again, being very happy and proud to be sitting here August 2nd, 2012, being the first system in Canada, and hopefully we will continue to add to what everyone else has done in terms of the adaptation and development of true 3D vision and system in ophthalmology. Thank you.